Okay, so Nicholas had advanced anti-wrinkle treatment 2 weeks ago, and so she's coming back in for the review, and we're going to look at certain areas. So we're going to have a look at the bunny lines, smoker's lines, DAO, mentalis, and masseter was the areas she had. So remember, mark where the lines are, where the muscle bulges, and if it's more than 50% improvement, repeat half the dose. If it's less than 50% improvement, repeat the same dose. So more than 50% improvement, half, less than 50%, repeat the same. So let's have a look at the bunny nose. So if you want to scrunch your nose, so we can see, keep the bulges there. It's going to go, and the bulges there. So obviously you would have seen Nicola 2 weeks ago, but that's definitely been more than 50% improvement. So normally I would give 10 diabetic units per side. So we're going to give 5 units today to soften those lines. So it's been more than 50% improvement, half of those 5 units. So that's the bunny lines. Next is the smoker's lines. So if you pout your lip, so you can see a couple of lines there, couple of lines there, and nothing there. And relax. So remember, from your initial training, we normally do 2 dots on the top right, 2 dots on the top left, and then 2 dots at the bottom. And if you pout your lips, same again, you can see there's no lines laterally, no lines laterally, no lines at the lower lip, and relax. So it's just going to be 1 unit on each of those there. So we normally give just 1 unit anyway. Obviously, it's going to be hard to give half, 0.5, so we'll stick to 1 unit just for those 2 dots. We don't need to give anything laterally on the lower lip. Then let's have a look at the DAO, the sad face. If you can do a sad face, so you can see a bulge there and a bulge there. Relax. So remember, if you draw a straight line from the corner of the nose to the corner of the mouth all the way down, the muscle occurs somewhere along that line. And if you do a sad face, so there's been minimal improvement in there, and relax. So we're going to give 5 units there. Next area we're going to look at is mentalis. So if you put your lower lip above your upper lip, that's it. And you can see quite a lot of activity still there, and relax. So remember, our initial dose is always 1 in the center, 10 units. What normally happens is when they come back, this is nice and smooth. It's laterally where there's still some activity. And so laterally what you would normally do is draw a straight line from the central nostril down to the border of the mandible, center nostril down to the border of the mandible. That's normally where you would need to give a top up there. So remember, it's 10 units. Normally you just need to give 5. And you just put your lower lip above your upper lip. But there's still quite a lot of activity there, and relax. So we're going to repeat the same dose because it's been less than 50% improvement. So we're going to give 10 units directly, exactly the same again, and then we'll review in another 2 weeks. Last area we're going to look at is masseter. So if you want to clench your teeth, so same again, we're going to outline the muscle. If you just want to turn to your left and relax. So what we do is get Nicola to clench. We can feel the bulge, do the triangle, and relax. So normally on the initial dose is 5. There's definitely been more than 50% improvement because there was a big massetic hypertrophy there. So we're going to give 2. If there'd been less than 50% improvement, we'll repeat the dose 5. And obviously we'll do the same on the other side there. Okay, if we just want to look straight ahead. So generally, first, mark where you need to inject. Second, determine how many units you're going to give. If there's less than 50% improvement, repeat the same dose where required. If there's more than 50% improvement, half the dose.